Peace and blessings, fam. It's your girl T. Yes, please subscribe because I upload new videos every single week. And visit us on Facebook at T's Braids and Weaves. Visit our website at T's Braids Weaves G&G Hair Growth. Yes, hair loss can be devastating. There are so many reasons why. For her, it's the side effect of chemo. Yes, chemo has thinned her hair up at the top and it never came back. But no worries, ladies. Why? Because I can help. No more feeling ashamed or feeling self conscious. Your hair can look like this. You can have beautiful hair. You can have fuller and longer hair. You can feel good about yourself and your hair because why? No one has to know. You can smile and enjoy life. Yes, this is my client today, and as you can see, her hair is very, very thin. You can actually just see straight through her thin hair to her scalp. And she is so, so tired of that. So she came in today to get some extensions. Yes, I am now going to start her braid pattern or her braid foundation. I am going to do it in a braid pattern called a beehive. This is going to be the best braid foundation for that nice full look that she is wanting to cover up all the thinning that she has here at the very top. So yes, continue to keep watching. I'm also going to share a little information about chemo and hair loss. I hope that you find it very, very helpful and very informative. So again, please continue to keep watching and see how her style is accomplished.
Too many of us are faced at some point in our life combating cancer. And still a very common way of treating is through chemotherapy. And some chemotherapy medications unfortunately cause hair loss. And for many patients, the loss of their hair is almost as upsetting as having the cancer itself, because it's something that tells the world and tells them that something radically is different in their body. The reason you lose your hair from chemotherapy is because our hair follicles are very active. As we know, we have to cut our hair every few weeks, every couple of months. So chemotherapy medications tend to go after cells that are replicating very quickly, such as cancer cells. So it has a tendency to go after anything that replicates quickly, and unfortunately, our hair follicles get affected by that. The hair loss from chemotherapy is temporary. Once you remove the medication, the hair will grow back. Not all chemotherapeutic agents cause hair loss. Ask your oncologist if there's a medicine that they feel will work optimally for you that won't cause hair loss. If they feel you need a medication that will cause hair loss and that there's no other choice for you, then just be prepared you're going to lose your hair. In fact, you may lose all your hair in your body. Why? Because the chemotherapy is affecting your entire body, and all your hair follicles, whether it's on your lower leg, your eyebrows, your eyelashes, your scalp, will be lost during chemotherapy. Some patients say there is pain associated with it, and some say there is no pain. It's variable from patient to patient. We're not sure what's causing the pain, whether the pain is in fact a direct result of the chemotherapy destroying the follicles, or whether there's pain beyond the skin, the stress basically of losing the hair. It's easier for a man, frankly. These days, many men just decide to shave their hair off as a fashion statement. It's very popular, society accepts it. For women, that's a different story. It's a lot of stress. Clearly, when you have cancer, you want to fight it and you want to beat it. So clearly, you want to go after the optimal treatment, including if that results in temporary hair loss. One of the wonderful things that's developed in the field of oncology is support groups. And hospitals throughout the country and throughout the world now are very sensitive to this issue of hair loss and have excellent referral sources for both support and actual options, including temporary hair pieces that look completely natural for patients. These days, often I will not know that someone has a hair piece and no one will know that you have one. They're excellent, affordable, and available for patients undergoing chemotherapy. Some insurances now do at least partially reimburse for the cost of a hairpiece. If you choose not to wear a hairpiece, if that's not for you, there's other great fashion things you can do, such as scarves, wraps, and hats to camouflage your hair. Speaking again to support groups, other people who've been through it will give you good ideas, good tips on how to make yourself feel better about yourself while you're undergoing the chemotherapy. Unfortunately, the same rules apply for children as adults. Children that undergo chemotherapy will lose all their hair. The Hair Foundation does partner with the Childhood Leukemia Foundation, which is an excellent resource for providing hair pieces for children undergoing chemotherapy. What happens to your hair when it grows back? Patients ask, will it grow back fully? Most of the hair grows back exactly the way it was before. Some patients are convinced, and I don't doubt them, that their hair is growing back thicker than it ever was before. Is it possible that a chemotherapeutic agent affects our matrix cells that create our hair follicles to either make them thicker than before or thinner in an individual? I think that's very possible that it does. But the important point is your hair will grow back once the chemotherapy is over. Speak to your oncologist, go to the support group, because if you know what to expect with your hair loss, if you know that it's going to be temporary, it does make it easier for patients.
Okay, fam, I hope you found that information helpful. Wanted to share insight on what it's like to experience hair loss after chemo. It's a very sensitive subject, it's a very touchy subject. However, it is one of the side effects or one of the major side effects of having chemotherapy. So just understanding that your hair will grow back and that there are other options as wearing extensions, wearing a hair unit, or just wearing your own shaved head or wearing scarves and hats that will help complement you during that time of hair loss. So back to me installing her extensions. I am now closing it off. I made her a handmade closure for the top so that I can close it off so that it'll look as natural as possible. That's the whole goal, is to make her hair look as natural and free flowing as possible. So continue to keep watching and you how her completed style came out. And again, no one has to know that you have any hair loss, any thin hair, or any balding from chemo. So just know there is help.